Hi, I'm Angela Hill. I've been involved in animal welfare forever. Heartworm disease is a potentially fatal disease that can affect animals from around the globe. The highest prevalence of cases in our country occurs in the southeast because the warm, year-long climate creates a hospitable environment for mosquitoes. However, there are other socioeconomic reasons for high rates of heartworm disease in this region. A nematode, meaning worm, causes heartworm disease. The scientific name of the worm is Dirofilaria immitis. In the United States, the reported yearly canine heartworm disease case number approaches 1 million. Heartworm disease occurs most frequently in pets whose owners can't afford to go to a vet, so most cases go unreported. Many shelters, especially under-resourced ones, don't test dogs for heartworms. That's because these shelters cannot afford prevention or treatment, and if a dog tests positive, it's an automatic euthanasia. If a shelter doesn't test or provide prevention, a new owner will not know the heartworm status of their dog. Transmission to healthy dogs in shelters through mosquitoes is also possible. It takes two to tango. A dog and a mosquito complete the life cycle of a heartworm. Microfilaria cannot develop into adult heartworms without the help of a mosquito. The heartworm begins his life in the dog as L1, or microfilaria. About 30 species of mosquitoes can carry heartworm larvae, but it's only the female mosquito who plays a part in transmitting heartworm disease. The mosquito's role is twofold. She picks up and delivers. She picks up the L1 baby, microfilaria, from the dog, and that L1 molts twice in the mosquito's body to L2 and then L3. The mosquito bites a dog and takes a blood meal and deposits L3, which molts inside the dog for over 2 weeks to L4. It takes 3 to 5 months for the L4 to develop into an adult heartworm, L5. An average lifespan of a heartworm is 5 to 7 years. It actually takes 3 to tango because Wolbachia is a bacteria that represents an important relationship between the worm and a bacteria. Wolbachia is required for normal worm development, fertility, and survival. Including the antibiotic doxycycline in the treatment weakens the worms and decreases the inflammatory reaction to worm death during treatment. Heartworms are in fact usually lungworms and mainly live in the pulmonary arteries, which take blood from the right side of the heart to the lungs. In severe cases, worms can move down into the heart, causing dramatic disease, hence the name heartworm. As the disease progresses, dogs develop symptoms such as coughing, shortness of breath, exercise intolerance, and weight loss. Complications develop, and dogs may eventually suffer irreversible right-sided heart failure and death.
Humans can get infected by heartworms, but the worms don't mature inside the human body. They do not complete their life cycle and become adult worms. Canidae,
which includes ferrets and foxes, can get and transmit heartworm disease. Cats. The inner pup works primarily with dogs, but a quick word on cats. Cats get heartworms, and only a single heartworm can kill a cat or damage the respiratory system. Cats need monthly prevention, but fewer than 5% of cats are on year-round prevention. Heartworm disease is almost 100% preventable, but prevention is by prescription only, and pets who don't regularly go to the vet don't get prevention. That's where the inner pup enters, and we have conducted monthly prevention clinics since 2016. TIP strongly supports changing the prescription status of heartworm prevention to allow access to inexpensive prevention. Prevention. Dogs should begin prevention at 7 weeks and be tested yearly. The main reasons for the failure of prevention are lack of owner compliance, or the owner not noticing whether a dog is thrown up or failed to swallow a pill. Heartworm prevention works backward and kills larvae deposited the month before, but nothing is foolproof. 3 anti-parasitic medications are effective prevention against the early stages of the heartworm. These medications are ivermectin, milbemycin, and moxidectin. A pet owner can choose between monthly heartworm chewable pills, topicals, or extended injectable prevention that is effective for either 6 or 12 months. The American Heartworm Society recommends year-long prevention, but this is debatable in colder northern areas where year-long transmission is unlikely. However, even in cold weather, microclimates such as sunny spots where snow can melt, or small protected areas can harbor active mosquitoes. Year-long prevention can prevent other parasites as well and makes it easier to remember when to give the preventatives.
In certain breeds, particularly the Collie, Australian Shepherd, and sheepdogs, high doses of ivermectin, one of the common heartworm preventatives, crosses the blood-brain barrier and causes serious problems.
Vets can test for the mutation, so please consult a veterinarian before giving heartworm prevention to a dog in this category. A quick word about transporting dogs. We must avoid transporting and relocating heartworm-positive dogs unless that dog is symptom-free and microfilaria-free. This can be done by ensuring that they're on an effective preventive before transport. Some also advocate for using a mosquito repellent designed for dogs. This precaution ensures a mosquito cannot transfer the disease to another dog in the transport or at the destination.